Hi everyone. I chose an article called Psychological Well-Being in Persons with Dementia: The Role of Caregiver Expressed Emotion. The authors were Savary, Weirden, and Berry, and this was from the British Journal of Clinical Psychology. The abstract stated the study used a longitudinal design to explore how caregiver-expressed emotion impacts well-being in people with dementia. 61 individuals and their caregivers were studied. High expressed emotion was linked to higher anxiety and depression. Low expressed emotion had protective effects. The article's summary stated that dementia is increasing, and 90% of people with dementia experience psychological symptoms, and their caretakers are often untrained, and that can impact the well-being of their attitudes or expressed emotion. High expressed emotions such as criticism, over-involvement, is linked to worse outcomes. This study examined the influence of expressed emotion on anxiety, depression, and quality of life over a 6-month time period. There were 3 hypotheses. The first stated that high expressed emotion from the caregivers would be worse well-being at the baseline and in 6 months. The second hypothesis said high emotional over-involvement would be higher anxiety and lower quality of life. The third hypothesis is high criticism would mean higher depression. There were 61 people with dementia and 61 caregivers. They were recruited through the NHS, the Age UK, and the Joint Dementia Research. The inclusions were that the person had to be diagnosed with dementia within the past 24 months, English speaking, and over the age of 18. They did exclude people with major psychiatric or physical illnesses. The interviews were conducted at the person with dementia's home. There was the baseline and again in 6 months. This tested for their cognition, their depression, anxiety, and quality of life. And the measure was for the caregiver was through Chamberwell Family Interview for expressed emotion. The results showed that higher expressed emotion meant higher depression. Emotional over-involvement was higher anxiety, and there was no immediate impact at baseline, but the differences did emerge over time. It also stated that the average age of the patient with dementia was 72 years old with a standard deviation of 10.8, meaning between 62 and 82. The discussion and conclusion stated that high expressed emotion caregivers linked to worse long-term outcomes. Low expressed emotions showed improvement in anxiety and depression. Over-involvement had higher anxiety but no change in the quality of life. And criticism increased depression. This article was peer-reviewed journal and a very recent 2023, and it was from credible institutions. However, it was a single institution bias and a small sample, and it was mostly white UK-based, and it was voluntary enrollment, so that was a self-selection bias as well. I do feel that the 6-month time frame is too short, and the expressed emotion assessment was very subjective, and there was only one rater. The self-reporting issue could also be a weakness as well because we are dealing with people with dementia and their cognitive impairments may affect their responses. I do think that this article's goals were clearly restated and the findings were summarized very well and easy to read and understand. I do think that the real world implications were not fully addressed, and there wasn't any practical recommendations for caregivers. Some confounding variables could be the caregiver's mental health, the time of year, which could cause seasonal depression, and then every person with dementia, their progression has different rates. And then another thing that could impact things is the type of caregiver relationship, whether they were their spouse or their child, so on and so forth. Another thing that was missing would have been the caregiver mental health, and it wasn't measured, but it was acknowledged as a possible influence. And then there was a lack of assessment of how caregivers' distress directly affected the outcomes. I do feel like the expressed emotion coding was not well explained, and the ratings of criticism or over involvement was very subjective and not really addressed. So, this study highlights the significant role of caregiver emotion in dementia care, but is limited by methodological weaknesses and scope. More diverse long term studies are needed to generalize findings and shape interventions.